Now we'll look at the anatomy of the external iliac vein. The external iliac vein. Okay. So this is the external iliac vein here. Let's try to identify it on this picture. Then we also want to identify it on this very picture, external iliac vein. So the external iliac vein is known as a large vein in the pelvis, and it's actually what, a continuation of the femoral vein. Okay, it's from the femoral vein. Okay, continues from the femoral vein. Okay, at the inguinal ligament, and it runs along the external iliac artery. It drains blood from the lower limb and some parts of the pelvis, and also joins the internal iliac vein to form what, the common iliac vein. So external will join the internal to form what, a common. Mind you, this is an internal, but it's cut because we're not actually focusing on the internal. Alright, so cause ascends along the medial aspect of the external iliac artery and lies anterior to the psoas major muscle. Ends by joining the internal iliac vein to form the common iliac vein. Alright, so tributaries, it receives what, blood supply from the inferior epigastric vein, deep circumflex iliac vein. So sometimes gives rise to all those small tributaries from pelvic plexus, venous plexus. Okay, so it runs medially to the external iliac artery, so it's close by. It's enclosed in pelvic fascia and is close to lymphatic vessels and nodes. So primarily is for what, blood drainage from the lower limb. Okay, and it joins the internal iliac vein to form the common iliac vein. Then all will now drain into the inferior vena cava. So we'll study the anatomy of this vein because it's good for you to know that it can be involved in deep venous thrombosis. If you are trying to do a surgery, then you have to, if you're doing a surgery in the pelvic region, you have to actually be mindful of this blood vessel. Then it's important in catheterization and also compression syndromes.